Good morning, Peter Goertz. I'm a psychiatrist. How to avoid burnout as a doctor. You're dealing with a lot of bureaucracy. Your boss may be focusing on productivity, telling you need to see more patients within less time, you need to stay late, or you feel pushed in some way to do more and more work, maybe come in on weekends, do your paperwork. You're concerned about job security, student loans, mortgage, paying for things for your family, for your kids. There are a lot of protocols that you may have to adhere to, and that can make you feel like you're not creative. You may be worried about lawsuits. You may really be focusing on dotting your I's, crossing your T's in every note and writing extensive notes to try and avoid a lawsuit. So here's my perspective. In the airline, if you're on an airplane, the flight attendant before the flight is going to say, or potentially in the past has said at least, take care of yourself before you take care of your children. So put on your own oxygen mask before helping someone else with their oxygen mask. So I'm encouraging you to be focused on yourself primarily, initially. So in my opinion, the initial primary focus is you need to enjoy yourself in your profession, whatever work you do, but specifically here as a doctor. You're going to be doing this for 40 years more. You have to, in my opinion, enjoy yourself. So admit to yourself, if that's true, that your main purpose is to enjoy yourself. And once you've admitted that to yourself, then other things can follow and help you enjoy yourself. So you also, most likely, I'm speaking for myself, I want to enjoy myself and I want to ease suffering. Now, they go hand in hand and back and forth. So if you're enjoying yourself, you're going to be more likely to help ease suffering. And if you help ease suffering, you're going to enjoy yourself more. So that's going to be more fulfilling. And patients are going to notice if you enjoy yourself. They're going to pick up on it. And they often can feel this doctor enjoys what he's doing. And as a consequence, they may do better themselves. If they notice you're enjoying yourself, you're enjoying spending time with them, you're enjoying treating them. Now, also, in spite of all the protocols and bureaucracy, in my opinion and in my experience, it is still possible to be creative. And that's also fun for me in various ways. You want to be creative with your time, save your time so you can get out of work on time. You want to be creative with patients, and that can make things a lot more fun. You want to have humor. That helps me a lot. So one experience that taught me a lot and that showed me that so-called little things can be very powerful is when I was an intern. I was on a surgical rotation and it was a weekend, and just myself and another intern were on call. And I had time. I stopped by the bed of a patient who'd been stabbed in the neck and rendered paraplegic as far as we know. When a drug deal went bad, he was stabbed in the neck, thrown out of a driving car, and as far as we knew, he was paraplegic. Now, that particular Saturday, like I said, I had time. I was standing by his bed, and on a whim, he was just lying there, and on a whim I said, "Move your toes." And he tried really hard to move all of his toes, and he was able to move one of his big toes just a tiny bit. But that did it. His face just lit up like sunshine. So again, so-called little things, in my opinion, can be very powerful, and that had an effect on him, and then by it having an effect on him, it had a major effect on me to help me realize that these things can be that powerful. And examples of humor could be, and you have to do things with your own style, but one example of humor would be once I was getting a lady who could be quite difficult in interactions, and I was getting her from the waiting area, and I noticed her hair was dyed pink. And I asked her, I knew that patient already, I'd seen her several times, and I asked her, is that your natural hair color? And she just lost all her potential defensiveness and just started laughing or smiling. Yeah, I think she even laughed. So that can really help interactions with patients. And again, humor I find enjoyable for myself. That helps me to enjoy my work day. Another experience that was touching for me was there was a patient who'd been for quite a few years in a state penitentiary, and he needed some help. I forget with what it was, but I was writing a letter to try and help him with something, just a brief letter, a few lines. And I was at the computer, I had my back turned to him while I was writing the letter on the computer, and I finished the letter, and then I turned around and the gentleman was in tears because he was so touched that someone was helping him. It seems like in his life, he'd had not many experiences of people helping him. And like I said, he'd been in a state penitentiary for many years. Thank you.